Okay, James,
Yes,
correct?
correct.
Hi, it's nice to meet you.
Thank you, you too.
My name is Dr. Perez.
Hey.
Welcome to the office.
Thank you.
So, according to your chart, I have you in for kind of a comprehensive physical exam. It looks like we're also doing a cognitive assessment today. Is that correct?
That's correct, yes.
Okay. All right, well, just to get started, can I have you confirm your first and last name for me?
Sure, James Monroe.
Perfect. And just the last 4 digits of your date of birth, if you don't mind.
Sure, 1990.
Perfect. I have you on Jefferson Avenue.
Yep.
Perfect. Let's go ahead and get started. It looks like we have quite a bit to go over today.
Okay.
Just kind of looking over my notes here. We have quite a bit of a physical assessment as well as a neurocognitive assessment.
Okay.
So why don't we go ahead and get started with that? I have a couple things that we'll go over. So the neuro portion of this examination is called an MMSE, or what's known as a mini mental status examination.
Okay.
Testing like full cognitive assessment, mental status evaluation, that kind of thing, okay?
All right.
So I have a couple things that we'll test in different categories. There are 6 categories.
Okay.
So the first part of the examination is going to be testing your orientation. We're looking for a function of awareness, your ability to sense time, place, person, that kind of thing, okay?
All right.
All right, so can I have you tell me the date, month, and year?
Sure, it is October 17th, 2023.
Very good. And can you tell me what city we're in?
Yes, we're in Jacksonville, Florida.
Perfect. And do you remember the name of this hospital?
Is it Jefferson University?
Very good. Yeah. So that just lets me know that your function of awareness is intact. You're able to tell me what kind of time, place, person is going on in this situation in particular, okay? So
Okay.
that is normal here. So let's move on to the second portion of the test, which is going to be registration.
Okay.
Now that sounds a little bit odd, but we're basically just testing your ability to acknowledge and understand or register information that I'm giving you.
Okay.
Okay. So I will have you remember these 3 words, and we're going to come back to them later.
Okay.
So I'll repeat them in a series of 3, and I want you to repeat them for me out loud.
Sure.
Okay. So door, book, window.
Okay. Door, book, window.
Very good. And try to remember those because we will be coming back to them in just a little bit.
Okay.
So moving on to portion 3 of the cognitive assessment, and we're testing for your attention and calculation, essentially ability to pay a reasonable amount of attention and calculation to kind of age appropriate equations.
All right.
So I'm going to have you verbally count to 21 in a series of 3, starting with 3.
Okay. 3, 6, 9, 12, 15, 18, 21, 24.
You're good.
Okay.
You're good. Overachiever.
I'm sorry.
That's okay. So I'm going to have you spell a word backwards.
Okay.
So I want you to spell world backwards.
Okay. World. D L R O W.
And forwards.
W O R L D.
Very good. Now I want you to solve an equation out loud.
Okay.
Can you tell me what 7 plus 14 is?
Yes. 7 plus 14 is 21.
Very good. Okay. So basic abilities to pay attention and solve calculations that should be age appropriate for you
Okay.
are intact. Okay. So moving on to the 4th portion of the examination, it's your ability to recall and remember information that was given to you within a reasonable time frame.
Okay.
So can you repeat back those words that I had you remember a few minutes ago?
Door, book, window.
Very good. Okay. So about 80% of people are able to remember 2 of the words.
Right.
So the fact that you remembered 3 shows that you're about average, above average in your mentation and ability to recall information.
Okay. Good.
Do you find that your memory is pretty well intact on a day-to-day basis?
For the most part, yeah.
Okay. All right, James, so let's move on to the fifth portion of the examination, which is testing language. Not your ability to speak a language, more so assessing speech pattern and linguistic functions, as well as facial tone and how you pronounce words, that kind of thing, okay?
Okay.
Also testing a couple fine motor skills here.
Sure.
So I am going to have you repeat after me, no ifs, ands, or buts.
No ifs, ands, or buts.
Good. Okay. So can you tell me what this object is?
Yes, it's a Sharpie.
And this here?
A clipboard.
Very good. So on this sheet of paper, I want you to take the Sharpie, take off the cap, write a 5-word sentence, any 5-word sentence of your choosing.
Okay.
Very good. Can you read it out loud to me?
Sure. The day is long forever.
Very good. Okay. So let's go ahead and place the cap on and set the Sharpie on the clipboard. There you go. Day is long forever. That's very interesting. Okay. So all of that was normal. You were able to compose a sentence that makes a reasonable amount of sense. It has a subject, it has a verb, that kind of thing, okay?
Yes.
Also testing your fine motor skills there, you're able to follow kind of a 3-step process, follow directions, set the pen down appropriately. So lastly, for the MMSE, we're moving on to part 6, and this is testing your executive function. So just give me 1 second.
Sure.
So I'm going to have you again complete a task on the back of the paper, and for this test we're kind of assessing your ability to plan, organize, and execute a specific thought.
Okay.
So what I want you to do, first, can you close your eyes for me and open and close and open? Perfect. Now I want you to copy a specific design. So I'm going to draw an object here. Can you tell me what that is?
A square.
Perfect. So I want you to copy it here. And can you make that into a 3D object for me? And what is that called?
It's not a trapezoid, it's not a rhombus, it is, I can't think of the exact technical name for it. It's not a rectangle, a cube.
Very good. Okay. So it did take you a little bit, but it is a cube.
Yes.
Perfect. Okay. So your executive function is intact. You were able to kind of think and critically think
Yes.
and organize your thoughts appropriately. So that is all very good. All right, James. So that concludes the MMSE, or your mini mental status exam. And all of that was within normal limits.
Okay.
So let's go ahead and move on to the physical portion of the examination, and we do have quite a bit to go over. I would like to start with a head and scalp exam. So I do want to have a look at your scalp, looking for any abnormal findings that would be anything not within normal range for your age and ethnicity, that kind of thing. Having a look at your hair,
Okay.
skin tone, texture, okay?
Okay.
So what I'll do is set this down, and if I can have you flip around on the table so that your back is facing me and you
Sure.
are facing the wall.
Okay.
Okay. All right, James, are you comfortable the way that you're seated?
Yes.
Okay. So I am going to go ahead and apply a pair of gloves, and we'll get started with the scalp exam. So I have a little metal comb that I'll be using to separate certain portions of your hair so that I can better visualize the scalp itself. Okay. So I'm going to start first with just my Penlight, just having an overall look at the hair itself. Can you tell me about how frequently in a week you wash your hair?
Once or twice a week.
Okay. And do you find that you ever have any symptoms of dandruff, flaking, itchiness, burning of the scalp, that kind of thing?
I have dry skin overall, so sometimes there is some dandruff.
Okay. Do you use any sort of over-the-counter shampoo for that?
I do. I use that for Head and Shoulders Extra Strength.
Okay, so like the blue bottle.
Yes.
Okay. Perfect. So that is dermatologist recommended product, so I have no qualms about you using it. Do you use it every time you wash your hair?
Yes, I do.
Okay. Do you follow up with a conditioner as well?
Yes, I do.
And do you place the conditioner on your scalp directly?
Yes, I do.
Okay. And you find that you have no problems with that?
No, not at all.
So you might feel me just do some slight tugging. I'm just testing for the follicle integrity, looking for any signs of folliculitis or inflammation in the hair follicle. Also looking for shaft strength, so the actual shaft of hair. I'm looking to see if there's any abnormal breakage, that kind of thing, if I'm getting a lot of hair loss. Just kind of checking around for any signs of traction alopecia. We tend to see a lot of that on the nape of the neck as well as along the hairline. Hairline traction alopecia is more common in women, whereas kind of the back of the neck here is more common in men. I do see a little bit of that happening here, but it's not anything severe and it is normal for your age range. Not notating any signs of androgenetic hair loss or pattern hair loss, also known as male pattern baldness, which is good. So I'll be taking my comb now. It just looks like this. It's a small metal comb. It is cold to the touch to separate just a couple different sections of hair. And mostly looking for any signs of dermatitis or seborrheic dermatitis. Is any of this uncomfortable or painful for you?
No, it's not. It's fine.
Okay, perfect. So not noticing any abnormal flaking, no signs of dandruff present at this time. Your scalp is not at all itchy at this time, correct?
No,
Just brushing out a few strands of hair in these areas where it's a little bit thinner. That would lead me to believe that this hair is slightly weaker, so I want to see if there's excess breakage in this area, but there doesn't appear to be so at this time. Very long hair.
yes. Well, ready for haircut.
Are you? Okay. How frequently do you get haircuts?
Not as often as I should.
Okay. You don't use heat products in your hair, correct?
No,
Okay. So really, because there's no heat damage, it's up to you how frequently you want to cut your hair. Really, the only time I recommend getting more frequent haircuts in my male patients is if they're getting headaches. Even with shorter hair, sometimes the weight of the hair can cause migraines, especially in those who have very thick, coarse hair. You have very thick hair and it's very dense. It's also healthy, but that can sometimes cause tension migraines, especially around the temple area. Just notating a couple things here. Okay. So overall, I'm not noting any, like I said, signs of that seborrheic dermatitis, which is scalp dermatitis or scalp psoriasis, which would require a prescription for a corticosteroid. We would give you injections in the scalp. It doesn't appear that you need that at this time. You are already using an over-the-counter dandruff shampoo. If I saw some more severe active flaking, I might suggest something like a ketoconazole shampoo, which is a medicated dandruff shampoo. It's usually brown and kind of foul smelling, but it can help. Dandruff is actually just an overload of bacteria growth on the scalp, but it appears that you are very well maintained and it doesn't look like that's necessary at this time. If those dandruff symptoms were to worsen, you could always let me know or contact your private dermatologist and they could also prescribe that for you. I'm just separating small sections so I can have a closer look at the scalp itself. Applying some slight pressure and agitation, looking to see if there's any exacerbated symptoms, but I'm not seeing anything at this time. So I am going to just palpate around your head. So you'll just feel my hands kind of moving around, checking for any kind of lumps or lesions, any areas of broken skin. Is any of this uncomfortable or painful?
No, it's not.
Any abnormal pressure anywhere if I kind of put a little bit of weight into my hands?
No, not at all.
Okay. Just gonna tug slightly. Is that painful?
No, it's not.
And then I do just want to do a very brief test for sensation here. Can you feel this?
Yes, I can.
Can you tell me what that feels like?
Rubber, a rubber finger.
Okay. Is it sharp at all?
No, it's not.
Is it sharper here?
Yes, it is.
Sharper here?
Yes, it is.
Less sharp here?
Yes, it is.
Even less sharp here?
Correct.
Very good, okay. So it is a sharp metal wheel, but obviously this area does not have any hair. So as I go up into the scalp where the area is thinner, you might still feel it, but as I go into a denser area, you probably won't feel it nearly as much. So that is an appropriate finding. And I just separate a small area here to expose the scalp. Is this then sharp again?
Oh, yeah.
Okay. Painful or just sharp? Okay. And here? Not painful.
No.
And here.
Yes.
Perfect. And all across here, the sensation is the same.
Correct.
Okay, very good. All right, James. Well, your scalp and head exam appears normal. If I could have you flip back around for me, we'll continue on with the rest of the physical examination, okay?
Sure.
Perfect. All right, James. Are you comfortable?
Yes, I am.
Perfect. So we are going to go ahead and move on to an examination of your lymph nodes.
Okay.
This will just kind of help provide me some information about possible presence of malignant or inflammatory localization and the process of that localization. So I'll be testing different areas and it allows me to kind of generalize any infection. So typically an inflammation of your lymph nodes tells us two things. Either you've had an infection recently, like a cold or the flu or anything like that, or there's something internally that's going on, something that could be more serious. So this is a very important part of the examination. So to get started, I am going to use my Penlight.
Okay.
I'm just going to have a look overall at the jaw and kind of neck areas, okay? Just looking for any inflammation or swelling.
Okay.
Specifically looking for any asymmetry from one side to the other. Not noticing any visible swelling on the exterior. Can I have you turn your head all the way over? Good. And we'll go all the way over the other side. Okay. You can bring your head midline. So I'm I'm going to perform some palpations of the area.
Okay.
So you'll feel me palpate your jaw, kind of behind your ears, around your clavicle, that kind of thing, okay?
All right.
So there are several lymph nodes here. I won't name all of them to you, it is a little convoluted, but we have some posterior and anterior nodes as well as cervical nodes, and I'll just be palpating them all. Let me know if there's any pain or pressure in any of this, okay?
Okay.
So if they are inflamed, you might feel some tenderness upon palpation. Just reaching up underneath the mandible here. I can just have you tilt your head back very gently for me. There you go. Is it alright if I pull your shirt down just slightly?
Sure.
Okay. Just going to help me expose these clavicular nodes. It doesn't appear that they're palpable at this time. Okay. So let's go ahead and move on to part of your oral examination, and I'm going to be performing kind of an intraoral inspection here, having a look at your palatum durum as well as your palatal velum. That's your hard and soft palate. So I will start with a penlight inspection.
Okay.
So if I can just have you open. Excuse me while I just come a little bit closer here.
Mm-hmm.
Just visualizing that palatum durum, which is your hard palate. Looking for any signs of abnormal discoloration. You're getting pretty close here. Visualizing the underside of the teeth, as well as the tongue. Looking for any signs of infection or abnormal inflammation. Can I have you bring your tongue to the top of your mouth? Good. And tilt your head down for me. Good. Perfect. Mouth open. Very good. Okay, and now tongue out. Say ah.
Ah.
Uvula is midline. One more time for me. Ah. Very good. Okay. Alright, so what I'm going to be doing now is performing just a little bit of teeth tapping. Okay, so just testing for any abnormal sensitivity in your teeth, which we then would have to recommend you to go see a dentist. So if I could have you smile, teeth, oh, there you go, perfect. Let me know if any of this is painful, okay? Any discomfort in any of these teeth?
No.
Any difference between the top and the bottom teeth?
No.
That all feels the same?
Mm-hmm.
Okay, good. So what I have here is called a bite block. So I'm going to be testing for mandibular strength and muscle atrophy, which basically is a reduction in the volume and density of the jawbone itself.
Okay.
So with age, we tend to lose bone density, so it leads to something called osteoporosis.
Okay.
You can also get that in your jaw. It can lead to something called TMJ, which we'll go over later, but basically just testing for that. You're a little young for that, but I do still want to make sure there's no even loosening in the teeth themselves, okay? So this is just a hard styrofoam. I'm going to have you bite down on either side, so let's start here. Bite down. Don't let me pull. Good. Let's do that on the other side. Bite down. Good. Open. Midline. Any pain or discomfort there?
No.
Okay. So open again for me. I'm going to do the same thing this time with a wider bite. Bite down. Good. Good. And one more time. Okay. Go ahead and open. Now one more time on this side. Bite down. Just testing those canine. And again, any pain or discomfort with that?
No, none.
Okay. Very good. Okay, so now I'm going to test your pharyngeal reflex, also known as your gag reflex, and this is probably the most unpleasant part of the examination. I do apologize.
Okay.
So I'm going to have you open and say ah.
Ah.
And we'll do that one more time.
Ah.
Very good. Okay. So you definitely passed that portion of the examination. Again, I apologize for the discomfort there. So now I'm going to test for TMJ, looking for your temporal mandibular joint, which is the joint here in your mouth.
Okay.
So I'll be doing a couple different things. I want you to open for me and close and open and close, open and close and open and close. One more time. Good. Close. Good. So I did not hear any clicking or popping. Is that anything that you hear on a regular day-to-day basis?
No, not at all.
Okay. So if we were to have heard something, then I might do some more extensive testing. A positive diagnosis would be TMD, which is temporal mandibular joint disorder, but I don't think that's anything you have today. So basically testing side to side here. So I'm going to have you move your jaw laterally for me. Good. And now all the way over this side and this side. Good. So basically we test on a bilateral basis. So it's a 0 to 6 scale on either side for a total of 12. 12 is a normal passing score, which I would say that you probably have today.
Okay.
Any symptoms of bruxism or teeth grinding? Do you grind your teeth at night or with increased stress?
I don't. Maybe once or twice a year I might wake up and have a sore jaw because of it, but it's not a thing really.
Do you find that you do it at all during the day?
No, I don't.
Okay, so mostly at night and not very often.
Yeah.
And no secondary symptoms like headache, migraine, jaw pain, soreness, anything like that?
No, none of that.
Okay. So the last thing I'm going to do for your oral examination is check your temperature.
Okay.
Excuse me while I just gather a couple things here.
Okay.
Placing a small sterile covering over this. I'm going to check this on both sides of your mouth. So I'll have you lift your tongue. Doing a sublingual temperature check. Go ahead and drop your tongue down. It takes just a couple seconds to read. Checking on both sides just to rule out any signs of isolated infection. Go ahead and check on the other side. And tongue down. Very good. Good. Okay, so you're at 97.4 on both sides.
Okay.
lights away. I'm just going to note that there were no abnormalities there. Okay, so we are going to move on to an orbital examination, and I'm going to dim the lights in the room so that I can better visualize your eyes as well as the insides of your eyes. I'll be using a special tool for that.
Okay.
Give me just a second while I turn the lights down. So I'm going to start by taking my Penlight and just going to be testing for pupillary constriction and dilation.
Okay. Should I take my glasses off?
You can leave them on for now. Okay. So I'll have you look straight ahead for me.
Sure.
Try not to look directly at the light.
Okay.
Just looking for consensual response here. So essentially, the eyes should work as a team and constrict and dilate accordingly as I move the light in and out of your visual field. So I'm going to perform what's called a swinging light test, and I'll just move my light kind of like a pendulum from one eye to the other. Just continue what you're doing.
Okay.
Very good, okay. Give your eyes a quick break while I catch up on my notes here.
Okay.
Okay, so what I'm going to do now is have you follow my finger, testing for horizontal gaze and nystagmus, or what's called smooth pursuit. So I want you to just follow my finger, keep your head straight. Okay, we'll do that again. This time I want you to follow the light. I'm just going to use my hand to hold your forehead. Just follow the light. Is there any discomfort as we go on the very outer end of your orbital field here?
No, there's not.
No pain or pressure?
No.
No double vision, blurry vision of the light?
Nope.
Perfect, okay. So I'm going to go ahead and turn the lights back on. Give your eyes a second to adjust there. So your EOM, or extraocular movement, and ocular motility is all within normal limits. You're able to follow it appropriately without any pain or abnormal pressure. So next I'm going to be testing your peripheral vision, and we're kind of testing for any abnormalities in your visual field, what you can see on the sides of your eyes on a day-to-day basis. I'm sure you can see things out of the corner of your eye, and that's part of your peripheral vision, okay? So testing for any certain retina conditions or any scotomas or blind spots. So what I'm going to do is hold this device up. Can you see this here?
Yes.
Can you tell me what color this is?
Yes, it's red.
Perfect. So I'm going to move this in and out of your visual field.
Okay.
I'll ask you when it disappears from your visual field, when it reappears, and I want you to just either say disappears, reappears, or you can say I see it, or whatever's comfortable for you, okay?
All right.
So I'll stand kind of to the side here so that I can get a better range.
Okay.
Just tell me when it disappears.
Okay.
Still see it there?
Yeah, I can still see it. Still see it. Still see it. Still see it. Disappears.
Good. Tell me when it reappears.
Reappears.
Disappears.
Disappears.
Reappears.
Reappears.
Disappears.
Disappears.
Good. Reappears.
Reappears.
Disappears.
disappears,
Good. Reappears.
reappears, disappears,
Disappears here.
yes,
Reappears.
reappears,
Disappears.
disappears,
Reappears.
reappears, disappears, reappears, disappears, reappears.
Good. So I'm going to do the same thing. This time I want you to tell me when you see it.
Okay.
See it here?
Yes.
No?
No.
See it again?
I see it.
Good. See it here?
Yes. No.
See it again?
See it again.
Good. See it here?
See it here. No. See it. Yes. See it. Don't see it. I see it.
Good. See it here?
I see it. Still see it. I see it. See it. Don't see it.
Good.
Reappears.
Good.
Disappears.
Good.
Reappears.
Good.
See it. See it.
And I'm going to bring it all the way far away. Can you see this here?
Yes.
Bringing it all the way, and I want you to follow it with your eyes.
Okay.
Follow it in. Good. Do that again. You see it here?
Yes.
Follow it in. Good. Okay. So standing on the side of you here, you can see this clearly.
Yes, I
I
can.
want you to tell me at what point that I bring it further away does it get slightly blurry, or
Okay.
if you can see it clearly the entire time.
It's clear the entire time.
Okay. And if I bring it in,
Mm-hmm.
does it get blurry? Blurry
Out
here.
there, yes.
Blurrier here.
Yes.
Can you
blurry
still see the color?
there. Barely, yes.
Better
Yes,
here.
Better there.
Okay, good. Okay, so no signs of stechomas or blind spots. Visual field appears to be within normal limits. So why don't we go ahead and move on to a test for color deficiency.
Okay.
Color deficiency or color blindness, as it may be known, is usually caused by an abnormality in the X-linked gene.
Okay.
So at this point in your life, it's probably something that you would already be aware of, but it can also be a secondary defect of diabetes mellitus, so we do like to go ahead and check.
Okay.
And to do that, I'll be using Ishihara test plates.
Okay.
So this is just a control.
All
Can you
right.
see this number?
Yes, I can.
Can you tell me what it is?
It's a number 12.
Can you tell me what color the number is?
It's orange.
And what color is this outside?
It's green.
Good. Is there a number here?
Yes. Number 8.
In here?
Number 5. 29. 74.
Good.
Number 7. 45.
Good.
Number 2. There's no number.
Good.
Number 16. And no number there.
See anything here?
Yeah, there's a pattern there.
Maybe trace that with your left index finger.
Sure.
Good.
Number 35. Number 96.
Good.
And just another pattern.
Can you trace that with your right index finger?
Sure.
Very good. Okay. So no signs of color deficiency, which is very good.
Okay.
And lastly, for your eye exam, I'm going to hand this to you. And
Okay.
this is a Snellen chart.
Okay.
I want you to hold it at extended arm's length.
All right.
Are you able to see it okay?
Yes.
Can you tell me what this letter is?
E.
Read down to the lowest line that you can see.
L T F P H O L C F D H J B S E P T Z O C F D H J L T F P H.
Perfect. What color is this?
That's red.
And here,
Green.
can you point to which one of these is smaller?
Yes, this one.
Perfect. So I will have you continue to hold that, and I am going to hold this up for you, and this is
Okay.
an ocular occluder.
Okay.
So I'll be occluding both sides. We'll start with the right,
Okay.
and I want you to read that again to the lowest line that you can.
E L T F P H O L C F D H J B S E P T Z O C F D H J L T F P H.
Perfect. Go ahead and switch eyes for me.
ELTFPH OLCF DHJBS EPTZO CFDHJ LTFPH.
Perfect. So I'll have you remove your glasses.
Okay.
And go ahead and include whichever side you choose.
Okay.
Can you read the last line?
No, I cannot.
Can you read this line here?
No, I cannot.
This line here?
EFTZJ
This line here?
OLCF
This here?
DHJBS
This here?
EFTZO.
Okay. Let's go ahead and switch eyes for me. Can you read this line?
No way.
This one here?
No way.
This one here?
Not at all.
This one here?
No.
This one here?
OLCF.
Very good. Okay. So you definitely need your glasses. With your glasses, your vision is 20/20. Without
Yes.
them, it varies in both eyes.
Mm-hmm.
The eye that seems slightly less high in acuity was at about 20/50. Okay. So glasses are definitely working for you. How long ago did you receive that prescription?
About 6 months now.
Okay, so they're pretty up to date.
Yeah.
And was that a change in prescription since the last time you went?
They said barely a change.
Slightly.
Yeah.
Okay, good. Definitely recommend keeping up with those examinations with your ophthalmologist. Doing a very good job there.
Thank you.
Okay, so let's move on to an ear exam. I'm going to be performing what's called an otoscopy, or an examination with my otoscope. It's essentially a device that allows me to see into the ears.
Okay.
So I'm just going to be shining a light into either ear. I'll have you just
Okay.
ear to the side for me. This might be slightly uncomfortable. It is a little cold. Okay, so I'm going to be getting pretty close to your face.
Okay.
And just visualizing the tympanic membrane, also known as your hearing drums. Looking for pearly white. No signs of excess cerumen or earwax. I do see a very small amount. Hair is evenly distributed, which is what we want to see. Very good. As I pull out, I'm also just visualizing the external auditory canal and the meatus. Okay, perfect. I'll go ahead and switch to the other side.
Sure.
Doing the same thing as I visualize this side. So again, pulling up and back to visualize the eardrum. Tympanic membrane is pearly white. No excess cerumen. Hair distribution is normal. No signs of foreign bodies in the ear. Okay. So what I'm going to do is attempt to visualize while also producing a small amount of hair in the ear.
Okay.
Might be slightly uncomfortable, shouldn't be painful.
Okay.
Essentially looking for a specific vibration movement of the eardrum here. Okay, so good. Any pain or discomfort there?
No, not at all.
Good. Okay, so normal movement. Okay. Very good. I'm going to go ahead and move on to an audiometry or hearing test. Testing for normal fields of hearing, that you're able to hear me speaking clearly, and that you can also hear specific stimulus that I produce in your ears, okay? I'm going to start with what's called a whisper test.
Okay.
I'm going to occlude the opposite side and whisper a couple series of words and numbers in this ear, and I'll have you repeat them back to me in a series of 3.
Sure.
Okay? gonna include the pinna here. Cat, dog, sheep.
Okay. Cat, dog, sheep.
Good.
Basketball, baseball, hockey.
Good.
Doctor, nurse, assistant.
Good. So now we're going to do a series of numbers.
Okay. 17, 27, 52.
Good. One more. 12, 21.
12, 13, 21.
Good. Okay. So we'll do that on the opposite side now.
Okay. Doctor, nurse, assistant.
Good.
Cat, dog, sheep.
Good.
Basketball, baseball, hockey.
Good. So I'll do 2 series of 3 numbers.
Okay. 17, 21, 57.
Good. 12, 23, 52.
12, 23, 52.
Good. So now I'm going to test your directional hearing.
Okay.
So I'll have you close your eyes. I'm going to move my hands around and I want you to tell me which side you hear it on.
Okay.
Could be side to side, front, back, anywhere around your head, okay?
Okay.
So just tell me what side you hear it on.
Left side, right side, left side, right side, front, front bottom, left side, right side, right side, right side, top right side, top left side, top both, top and right, right side, both again, both again, both again, right side.
Good, okay. So I'm going to do that again. This time I'm testing with a very kind of distinct sound.
Okay.
And I want you to tell me when you hear it, come closer to your ear, okay?
Okay. Close. Close.
Good. What side is this?
Right side. Left side. Right side, left side. Left side, right side. Right. Left. 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 Right. Left. Right. Middle. Right. Right. Middle left. Top left. Right. Both.
Good, okay. All right, James, so it appears that your auditory exam was normal. Hearing is intact. I didn't notice any abnormalities there, okay?
Okay, good.
Did you have any difficulty with any of that?
No, I don't think so.
Did you notice that it was harder for you to hear on one side versus the other?
No, I felt the same.
Okay. So let's go ahead and move on to a heart and lung assessment. I am going to be performing some auscultations of your heart and lungs. So
Okay.
I will go ahead and place my stethoscope on. Okay. So for this portion of the exam, I'm going to manipulate your shirt a little bit so that
Okay.
I can better auscultate the area, okay?
Sure, go ahead.
Just breathe normally for me. So have you sit up straight for me. Good. So I'm going to come around the back and do an auscultation of your lungs, okay?
Okay.
Okay. So I want you to just breathe normally for me. Just going to pull your shirt down a little bit. So I'll be placing my hands on your back. And as I do that, I want you to say 99, okay?
Okay. 99, 99, 99, 99, 99, 99, 99.
Good. I'm going to do that again with my stethoscope. Now every time I touch you, I want you to say 99. This is testing for any signs of bronchophony, which will let me know if there's any underlying consolidation in one side or the other, okay? So go ahead and say 99.
99, 99, 99, 99.
Good. Okay. So I will go ahead and come back around the front. All right, James, you are doing well. Give me just 1 second. I'm just going to catch up on a couple of notes here. We are almost done with the examination. Are you feeling okay?
Yes, I'm okay.
Any questions or concerns at this point?
No, I don't think so.
So bronchi are normal. No signs of any abnormal consolidation of one side or the other. Lungs appear to be functioning normal bilaterally, and cardiac health appears normal. Okay. So we are going to move on to an upper extremity examination. So I will be testing your limbs and extremities, so hands and arms, and really testing for any deep tendon reflex abnormalities. And this is part of the kind of peripheral neurological examination, okay?
All right.
So I am going to use my reflex hammer, and I'll be testing a couple different reflexes. So what I want to do first is test your triceps.
Okay.
So I will have you raise this arm up and back, and I want you to just rest all your weight in my arm.
Okay.
Good. So I'm going to have you just rest your arm flat, kind of prone. Good. Testing your brachioradialis. So we will have you flip your hand supine facing up, and I'm going to test your pronator teres, so just relax your arm for me. Good. Testing your fingertips, I'll have you curl slightly. Good. Okay. So repeat those tests on the other side. Testing your bicep here. Good. Okay. So you place your hand prone on your lap. Good. Supinate for me. While you curl slightly. Very good. Okay. So upper extremity reflexes appear to be intact. Pronation, supination, flexion, extension, and all of that were normal in all of the various positions, as well as on your fingers. So I am going to go ahead and assess your motor strength in your upper extremity. So testing for a couple different things here. Can I have you bring your hands out forward like this and eyes closed for me? Very good. Now can you bring your hands all the way up and all the way down and all the way out and in together? Any pain or discomfort there?
No.
Good. So relax your arms for me. I'm going to have you shrug your shoulders. Okay. And I am testing for your strength and ability to provide resistance. Okay. So I'm going to have you push up while I push down. Don't let me push you down. Okay. So push up. Good. Good. Okay. So I'm going to have you hold your hands up like this. Same thing, testing for strength and resistance. So I'm going to have you push out. Good. And now the opposite. Good. And just with your wrist, if I can have you bend slightly. Push me, good, and push out, good. And I'm gonna have you open your fingers like this, good. Don't let me pull them together. Good, good. Now together tight, don't let me pull them apart. Very good. Now I'll have you squeeze my hands tight, tight, tight. Tighter, tighter. Good, okay. So I want you to just stretch your hand out for me. I'm just going to have a look at the inside of your hand. Just quickly testing your capillary refill, looking for any abnormalities and blood flow return, but return appears to be +2, meaning that there is blood flow response in less than 2 seconds. So let's do a little bit of flexion and extension in your legs. If I can have you uncross your feet, push up for me, and down. Good. Can you bring your thighs together, and out, and up, and down. Okay, strength, normal, and you have full range of motion with and without gravity, as well as with and without resistance. It's normal, so I would give you a 5 out of 5, which is a normal response. So your muscles are able to function normally even with maximum resistance applied. So lastly, I'm just going to do a couple neurological tests here. So I want you to hold your hands out for me. Upside down. There you go. So what number is this?
6. 7.
Good.
I'm not sure. Oh, 5.
Good.
9. 4.
Good.
3. 1.
Good. And a letter. Capital.
B.
Good.
B.
Good. Okay, so going to have you hold your hand up like this and just relax. Good. Good. So I'm going to test some reflexes around your eyes and just testing for normal orbital reaction here. So I'm going to take your glasses off if that's okay. Just set them to the side. Just keep your eyes kind of lazily open for me, okay? Just testing for normal muscle reactivity in the eyes. Also testing for the integrity of your orbital socket. Good. Eyes closed. Good. Eyes open. Good. Now hang your jaw for me. Good. Good. Mouth closed. Don't let me open. Mouth open. Don't let me close. Good. Can you scrunch your eyes really, really tight? And open. Don't let me close. Can you puff your cheeks? Can you puff one side? Good. And the other? I'm going to have you bring your tongue to the side of your mouth. And the other side. And up and down. Good. Any pain or discomfort with any of that?
No, not at all.
Okay. So let me put your glasses back on.
Thank you.
Okay. So the very last portion of our exam is just going to be some light palpations and an extremely brief sensation test, okay?
Sure.
So I'm just going to palpate a couple areas here. Is this painful at all?
No, it's not.
And on the outer side of your elbow, also not painful at all?
No.
In your wrist here, no pain or discomfort?
No.
Your joints as well, no pain or discomfort?
No.
Maybe you squeeze tight your hand here. Good. Okay, so do the same on the other side. No pain or discomfort in the inner elbow.
No.
Outer as well is fine.
Fine.
Good. Squeeze tight for me. Good. Okay. So strength and rigidity is normal. So I want you to tell me if you can feel this and this.
Yes.
Okay, close your eyes for me.
Mm-hmm.
Is this sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp. Dull.
Good.
Sharp.
Good.
Dull.
Good.
Sharp. Sharp. Dull.
Good.
Sharp. Sharp. Dull.
Good.
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Or dull?
Dull.
Sharp or dull?
Sharp. Dull.
Sharp or dull?
Sharp.
Good.
Dull. Sharp. Dull.
You feel it through your shirt?
Sharp. Dull. 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 Sharp. 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 Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp. Dull.
Good.
Sharp.
Good. Very good.
Sharp.
Very good.
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull here?
Dull.
Here?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp. Dull.
Good. Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Or dull?
Dull. Dull. Sharp. 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 Dull. Sharp. 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 Sharp.
Good. Very good. Okay. Tried to trick you a couple times, but you did make it. So, does this feel cold to you?
Yes, it does.
Does this feel warm?
Yes, it does.
Tell me cold, warm?
Cold. Warm. Cold. Warm. Cold. 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 Warm. Cold.
Okay. Cold or warm?
Warm.
Cold or warm?
Cold.
Cold or warm?
Warm. Cold. Cold. Cold.
Cold or
Warm.
Okay.
Cold. Warm.
Okay. Cold or warm?
Can't tell. Cold. Can't really tell.
Okay.
Cold.
Good.
Cold. Cold. Cold.
Good. Cold or warm?
Cold.
Cold or warm?
Cold. 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 Warm. 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 Cold. Warm. Cold. Cold. Warm. Cold. Cold. Warm. Cold. Cold. Cold.
Good. And this cold is the same as this.
That's correct.
And this cold is the same as this.
That's correct.
Same cold here, 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 and here.
Yes, it is.
On your legs, does that get any less cold?
No, it does not.
Here, any less cold?
No, it does not.
Same cold here and here,
Yes, it is.
here and here.
Yes.
Okay, cold or warm?
Warm. Cold.
Very good, okay. All right, James, I would say that you are in perfectly good health.
Awesome.
As far as your neurological functions
Okay.
are concerned, everything is normal. All of your numbers are within normal limits, and I didn't notice any abnormalities, okay? So I would say you are probably good to go until next year's annual exam.
All right.
Do you have any questions?
I don't think so.
Do you have any concerns outside of what we tested today?
No, I don't. Not
Okay.
this time.
No abnormalities going on with your lower extremities, abdomen, back, anything like that? Anything that we didn't test?
No, not at all.
Okay, all right. Thank you so much for coming in.
Sure.
Had a great exam, and I wish you the best of luck.
All right. Thank you
Have
so
a good
much.
evening.
All right.